The NETTER-1 study is the first phase 3 prospective randomized clinical trial of a radiolabeled somatostatin analog. Investigated lutetium dotatate, which is a new generation radiolabeled somatostatin analog. Lutetium is a beta and gamma emitting isotope. It tested this drug versus high-dose octreotide in patients with midgut neuroendocrine tumors progressing on first-line somatostatin analogs. And we know that there really are very limited systemic treatment options for patients who progress on first-line SSA. The primary endpoint was progression-free survival by central radiology review, and the results were really quite striking. There was a 79% improvement in hazard ratio for PFS. The PFS on the control arm, high-dose octreotide, was 8 months. It has not yet been reached with lutetium dotatate at the time of the primary endpoint analysis. The response rate was also substantially higher with lutetium dotatate. It was 18% versus only 3% with the control arm. And it's important to emphasize that thus far we have not seen systemic agents result in double-digit response rates in this population, so it's really quite encouraging. As far as overall survival, this is an interim look at overall survival, and there is some updated data compared to previous presentations. The hazard ratio for overall survival was 0.4. Now, there was a 60% improvement in overall survival with a p-value of 0.004. Now, the threshold for overall survival improvement for statistical significance is actually has 4 zeros behind it, so it didn't quite meet that very high threshold because it's an interim analysis. We're certainly hopeful that on final analysis at overall survival, which is expected in the next year or two, we'll see really clinically and statistically significant improvement in survival benefit with this drug.